Hi guys, welcome back to my channel. It feels so great to be back with another video for you guys. So today I'm going to talk to new nurse practitioners, and I'm just going to give you a really cool tip that I received at the beginning of my NP career. Now, I've been a nurse for about 21 years, but I've been a nurse practitioner for 6 years. And I know that those early years can be frightening. They can be overwhelming. There's just, an overload of information, and it's difficult. The transition going from bedside nursing or just going from, nursing to advanced practice. It's a different ball game. So this tip that I'm about to give you guys, I received the first year that I was practicing as a nurse practitioner. And even today, I still tweak it a little bit and I still use it a little bit. Yeah, I do pretty much. I learned my top 10 chief complaints, and when those things would come through the clinic, I was able to knock it out really quick because I had done extensive research on those things and I felt like I had mastered them. Having these top 10 chief complaints and knowing them like the back of your hand, when those things come through, you will just be able to run through that visit and you'll feel like an expert in those things. You do still need to do research just on general things that interest you, things that you've seen, things that you're aware that you're weak in, things that you want to know more about. And sometimes I'll even take time to go and refresh my knowledge on these things because medicine and nursing, things change quickly. So you don't want to get stuck in just having old information. So it is really important to take your list sometimes and just go through it and update your information. So this tip has helped me out a lot. I can remember the first few weeks of practicing, I had in the notes section of my iPhone, I had my top 10 chief complaints, and I even went as far as to write down different treatment options that I was familiar with and that I liked to use. Now, keep in mind that, again, patient care is individualized. So you can't just have, every time someone presents with an upper respiratory infection, okay, here's some Bromfed or here's some Guaifenesin or everybody gets benzonatate. It has to be individualized. Some people are allergic to certain medications. Some people just don't like this medication because they tried it before and it didn't work. Some people have high blood pressure, so you're going to stay away from decongestants. So yeah, you do have to individualize the care, but have options. So when we get into knowing 10 more of the top chief complaints that you see, I will share my chief complaints that I see most frequently, 11 through 20, with you guys. No particular order, which would be positive pregnancy test, erectile dysfunction, dizziness, chest pain, joint pain, muscle aches, and then getting into abnormal labs a little bit. Increased serum creatinine, increased hepatic enzymes, increased calcium, and anemia. It can be all chief complaints, but I sort of added in a few of the most frequent abnormal labs, which kind of leads me to just tell you guys what my next video is going to be about, which is going to be about a book that I recommend to help you with lab interpretation. I don't want this video to be too long, so that'll be my next video. and we'll just talk a little bit about my favorite book that helps with lab interpretation. So I hope this tip helped you guys. Please comment below if you already do this, because I'm just wondering who else does this. It's really helpful. It's been really helpful for me. It's also, like I mentioned earlier, really helpful for me to still have this list, my top 10, and then I add another 10. So honestly, it's top 20, but just so that you're not overwhelmed, start with the top 10, and then you can do another top 10 so that you can have 20. And those things, you're just an expert. So I hope this tip is helpful for you guys. If you're a student, you should have made notes, and you should be planning on utilizing this tip in your practice. I had so much fun making this video, and I can't wait to talk to you guys about my the book that I've been using for lab interpretation on my next video. So stay tuned. Make sure you like and subscribe and hit the notification bell so that you don't miss any of my videos. I love you guys. Take care. Bye.